Hi, my name is Rola. I'm in my third year of honors science and I go to Wilfrid Laurier University.
And hi everyone, my name is Madumitha, and I recently graduated from York University with my Bachelor of Science in Kinesiology and Health Science with a minor in Psychology. And today we're excited to do a presentation on dental care for the elderly. Oh my God, sorry. Okay, so let's begin. We're trying to introduce about dental care. So like other areas of the body, your mouth is covered with bacteria. They're sometimes harmless, but a lot of bacteria is present. It is very important to remember that your mouth is the entry point to your digestive and respiratory tracts, and these are some pathways where the bacteria can cause disease. Normally, the body's natural defenses and combined with good oral health care, such as brushing, flossing, could keep bacteria under control. However, without proper oral hygiene, bacteria can reach levels that may lead to oral infections, such as tooth decay, gum disease, etc. This is why it is so important to understand the role that oral health has towards maintaining our overall health. Now, why did we pick the elderly population compared to everyone else? There's so many other areas we could focus on, but why did we focus on elderly? Well, because with the world population being almost 8 billion people and nearly 700 million people in the world are aged 65 and older. So advancements in medicine has reduced the rate of mortality, and the older population is increasing. Now, looking at Canada, for example, we see that there's a trend with decreasing fertility rates and increasing life expectancy. And older population is expected to grow by 68% in the next 20 years. So the proportion of elderly will rise from being 1 in 11 people to 1 in 6 people, which is literally double the rate of population growth. And with that, chronic non-communicable diseases are also going to become common with increasing lifespan. And combining these chronic diseases with degenerative changes that come with aging, older adults do become vulnerable to oral diseases. And this is why it is important to make good dental care for seniors a priority, and how you can do your bit to help your elderly loved one improve their oral health. And that's that. And oh, sorry. So here's the agenda for today. So here are some of the topics we will be discussing about oral decay, darkening of the teeth, gum diseases, denture stomatitis, edentulism, oral cancer, dry mouth, and we will be concluding with a quiz to see how well you guys paid attention, and followed by a Q&A if you guys have any questions. So first disease is denture stomatitis. There's some technical difficulties. Okay, sorry. Okay, so denture stomatitis. This is a very common condition among elderly, which is characterized by inflamed, puffy, red tissue that follows the outline of the denture or other dental appliance that rests on the oral mucosal area. And it is caused by a type of fungus called Candida. Each and every single one of us have a small amount of this fungus, but when it becomes imbalanced or it goes out of control, we get conditions like denture stomatitis, which is particularly prevalent in the elderly population. So symptoms. So people with denture stomatitis may have varying symptoms. The most common ones include pain and discomfort when chewing or swallowing, soreness in the mouth and throat, red patches on the gum, tongue, inner cheeks, and roof of the mouth, sores and cracks in the corner of your mouth, change in taste, and decreased saliva production. Causes. So there are several causes that result in the development of denture stomatitis. Here are some of the common ones. So wearing dentures for for prolonged periods of time, even when you're sleeping at night. Poor oral habits, diets that are very high in sugars and carbohydrates, alcohol use, smoking, and using medications that involves a broad spectrum of antibiotics. And other physiological risk factors include age, especially very common with older population, age 65 and above, nutritional deficiencies, endocrine dysfunction, and immunosuppression. So diagnosis and treatment. For diagnosis, generally with denture stomatitis, it is detected during the oral or dental examination. The dentist will give you specific details on the condition and how you can take care of it based on the pattern of the redness in your mouth. They usually take a swab in your mouth and submit the sample to the medical lab to kind of confirm the diagnosis. So treatment. So here are some treatment options that have been proven to be very effective. Laser therapy. Basically, they use low energy laser therapy to treat this condition, and it's super effective if when say light medications don't work. Secondly, antifungal removal. It is medication in the form of ointment to reduce the symptoms of inflammation that comes with denture stomatitis. And surgical removal, let's say some patients when they do develop small nodules on the roof of their mouth, and this can interfere with your denture and prevent it from fitting. The denture will not fit properly when you have those little nodules forming in the roof of the mouth. So in that case, the dentist will perform a minor surgery to kind of remove those and to just make sure that the denture fits in better and it's in good shape. Prevention. So here are some methods that a person could add to their routine, and they can practice it regularly to just prevent the issue of denture stomatitis altogether. So good oral hygiene. So it's important that you keep your mouth as clean as possible and rinse your mouth and dentures after meals. Smoking is discouraged because it will promote the growth of the fungal infection. Keeping your dentures as clean as possible. So especially overnight, and try to some yeast infections will clear up completely if you don't wear dentures at night for at least 2 weeks or so. So and also brush and soak your dentures every day. Make sure like all the bits of food are removed, and try to use a non-abrasive denture cleaner, and making sure you don't scrub your dentures too hard, as this might cause grooves in the surface. And make sure that if your dentures do contain metal parts, don't use things like bleach to clean it. Instead, use cleaners that have chlorhexidine to make sure it doesn't have that corroding agent in it. And that brings us to the next topic of
Okay, so Another really important oral health disease is root and tooth decay. So root and tooth decay are also described as cavities or dental caries. So cavities are infected areas on the tooth surface and are represented by small black holes. They arise from a buildup of bacteria and plaque from food left behind or from an unhealthy diet like eating junk food or drinking soda. Root decay, on the other hand, are also known as root cavities, and they indicate the formation of lesions on the surfaces of the roots of the tooth. So your lesions are found near the gum or the gingival margin. Root and tooth caries are most prevalent in elderly people. Cavities commonly form in the midline of the tooth next to the gum. And gum recession occurs as one continues to age, causing the soft root tissue to be revealed, therefore allowing for root caries and decay to occur. Unlike the crown, roots do not contain any enamel as a barrier of protection, so it makes them a lot more susceptible to decay. And if it's left untreated, the tooth and the root decay can lead to the tooth being lost. Next slide. Okay, so for roots and for the stats for the root and tooth, so root and tooth caries are mainly in individuals over 65 years of age and are more prevalent in them than root and tooth decay in children. 18% of seniors who are age 65 and older have untreated decayed teeth, and 93% of seniors who are age 65 and older have had caries on their permanent teeth. Okay, so some symptoms of these cavities are tooth pain or achy feelings, especially after consuming anything hot or cold or sweet. If you observe any black holes on your teeth, you might also experience tooth pain, any red or swollen gums, dry mouth, mouth sores, white or red patches in your mouth, bad breath, loose teeth, or poorly fitting dentures, all in which you should definitely consult your dentist about if you see any of them. So ways to diagnose root and tooth decay involves the dentist asking a couple questions like, do hot or cold food temperatures cause you pain? Does biting down make your pain worse? How often you brush or how often you floss your teeth? Do you use toothpaste that has fluoride? Do you eat or drink sweets often? And like what kind of medications you take? And if you've noticed any dryness in your mouth. Such questions will give your dentist a better understanding of what you are experiencing and what daily habits you perform that may affect your oral health. So causes of root and tooth decay can involve aging. So as we age, gum tissue recession occurs, which exposes the roots of your teeth, allowing for contact with decay causing acids. Since roots do not have enamel, root decay would occur faster and more easily than crowns. The decay causing acids can also cause tooth decay, which proceeds a lot slower than the root decay. Elderly people commonly have dentures, which also elevate the chances of developing root and tooth caries. Another cause can be the lack of saliva. So saliva produces or it provides a protective barrier for your teeth. So without an efficient amount, it can allow for tooth decay to proceed faster. Any foods with very high amounts of sugar or starch that are left behind will be converted to acids by the bacteria in your mouth. The bacteria with the acid, with the saliva, and the food all create plaque. If it is not removed, it can harden and become tartar, which causes gingivitis and periodontitis. So the enamel on your teeth that provides a protective barrier can become destroyed by the acids in the plaque. And if it's untreated, gum disease can occur. So ways of preventing tooth and root decay involves brushing twice a day to prevent plaque buildup, flossing, maintaining good oral health, avoiding anything sugary or anything that has a lot of starch, reducing snacking, avoiding any kind of sticky foods because they remain in your teeth for a long time, brushing with fluoride toothpaste after eating or drinking, and rinsing your mouth with fluoride and drinking tap water, which contains fluoride as well. Going to the dentist regularly for cleanups and checkups, and of course, to not smoke. So cavity treatments depend on the severity of the individual's case. So for mild situations that involve the onset of cavity, fluoride treatments are used to restore the tooth's enamel and reverse the cavity. So fluoride treatments typically contain high amounts of fluoride, higher than like toothpaste and mouthwashes. These treatments may either be liquid or gel or foam or a varnish that are applied onto your teeth directly or in a small tray. For cavities that have passed their onset stage, fillings are required as the main treatment to repair and restore damaged, cracked, or broken teeth. The dentist will basically, first, they will drill a hole in your teeth, removing the cavity and filling it with a filling that composite resin. This will replace the drilled area of your tooth that's been decayed. So for very large cavities, crowns are created to cover your tooth's natural shape and are used to replace your entire tooth. The dentist will also drill the decayed parts of the tooth and place the crown right over it. If the decay has reached the pulp, which is the inner part of the tooth, root canals are necessary to save the tooth without removing it. The pulp of the tooth is removed, clearing the infection and replacing it with a filling. And lastly, if the decay is extremely severe to the point that there was no possible way of restoring the tooth must be extracted and patients are able to follow up with a bridge or a dental implant to make up for the gap.
Okay, so that brings us to the topic of inantualism. So basically, how to describe this condition is basically it is irreversible and it's described as the final marker of disease burden for oral health. So it is defined as the complete loss of the natural teeth, and it is very much common in elderly population compared to others. And it is one of the public health burdens for elderly people and affects the practice of primary care. Okay, causes. So there are several causes that can result in the development of tooth loss, and here are some of the common ones. Um, Common factors include plaque accumulation and hardening, gum recession, older fillings and things like that. And lifestyle factors could include gender, most commonly affects elderly males than females, smoking, poor diet, inadequate personal oral hygiene, diabetes, mellitus, hypertension. External factors include lack of education. So, lack of education about understanding the causes and consequences of tooth loss prevents people from taking proper preventative lifestyle and oral health care measures or from getting periodic dental maintenance or necessary restorative treatments. Fear and embarrassment, another big one. Many people like suffer from dental phobia or have anxiety or fear going to dentists, and therefore they don't seek dental treatment even if they know they have the problem or are in pain. Others are embarrassed or ashamed to seek dental treatment because they feel that they will be blamed or judged negatively for the condition that their teeth of the condition of their teeth. And ignoring tooth decay and other serious dental problems can also, because they haven't gone to the dentist for so long, and it could prolong and aggravate their condition. Finances Again, some people have to postpone or forego their dental visits and treatments, including regular checkups and cleanings, due to high dental care costs and lack of insurance coverage. And unfortunately, prolonging or eliminating their dental care increases their chances of developing serious problems, and subsequently creates greater expenses for the repairs and damages that their condition is um, that they're suffering from. And medical treatments, and so certain treatments such as chemotherapy, radiation therapy, immunosuppressive medications can weaken one's immune system, and these treatments may increase the risk of tooth infection, and so consequently they would need to get their tooth extracted. Oops. Okay. And consequences of this: mental anxiety and changes in facial features, loss of bone and gum tissue. They have trouble eating, speaking, and results in poor nutrition as a result. Very leads to them being very self-conscious, dissatisfied with the appearance, and loss of confidence, socially embarrassed, and they isolate themselves. Um, Also, with tooth extraction comes with a lot of pain and distress, and they have trouble relaxing, and also financial burden for the costs of possible treatment options that they have to go through. Prevalence. So in Canada, the overall prevalence of tooth loss is about 22% among adults, older adults between the age 60 to 79. And looking at across different provinces in Canada, there is a very varying rate for tooth loss, all the way from going to 14% in Quebec to 5% in cold regions like Northwest Territories and things like that. And this is mainly because of the increased rates of smoking, and also access to fluoridated water. Okay, prevention and treatment. Prevention, basically having a discussion with the dentist is very important to figure out the different preventative and detection strategies to maintain an individual's general oral health. And some of these strategies could include just patient education, educating the patient about this condition and what causes it, knowing the consequence if you do get the condition, and following proper preventative therapeutic treatment and oral health practice, and checking in to see whether, like, whatever your daily routine is, if it's going to help with your condition, or you need to do more, or what other strategies you could work on. So that's an important thing. And treatment, so let's say tooth loss is inevitable and unavoidable, then here are the treatment options that one can have. Dental implants these are basically just artificial roots that are surgically kind of attached to the jaw to secure the replacement of the tooth, bridge or denture, whatever. And it is permanent and stable, and implants do function like a normal teeth. So that way it's really good. And sometimes you could support implants with dentures to kind of stabilize things a little bit better. And dentures, again, removable replacements for missing teeth. And you could get partial dentures in spaces where there's spaces created by the missing teeth, just to make sure that the other teeth don't get shifted, and that your natural teeth are still where they are. And again, like, if you completely like lose all of your teeth, then you have to get full dentures. And a dental bridge, which is basically false tooth that is infused between two porcelain crowns to fit in the bridge in the space where there is that missing tooth. And the crowns basically hold the dental bridge in place, and it is cemented. to either side of that space, just so that it's secure and it's irremovable. And as usual, regular checkups with your dentist is a must. Oh, sorry. Yes.
Okay, so the next very important oral health disease is darkening teeth. So darkening teeth involves the discoloration of the tooth, which may suggest the presence of dental caries, which forms stains on your teeth. So causes of darkening teeth may involve aging. So as you age, the outer layer of enamel on your teeth worns out, exposing the dentin, which has a very yellowish color. The dentin will also grow as you age, which decreases the size of the pulp. Lack of enamel development may also cause your teeth to appear darker. Changes in dentin beneath the enamel, the thinning of the enamel layer, any kind of staining foods or drinks like coffee, tea, wines, pasta, or potatoes, smoking or using tobacco, any poor dental hygiene like forgetting to brush and flossing your teeth can leave plaque left behind in your teeth. And skipping professional dental cleanings can also cause stains. Other environmental factors like exposure to very high amounts of fluoride, like in water or toothpaste, may cause white spots on your teeth as well. So ways of preventing darkening teeth is to take care of your teeth by brushing and flossing, to reduce smoking, avoid drinking or eating any foods that stain your teeth, keeping a reusable straw to prevent liquids from hitting the front of your teeth directly, and drinking lots of water to rinse your mouth after drinks that contain acids or drinks that may stain your teeth. So treatments for darkening teeth includes teeth whitening that can be done by your dentist. There's also dental bonding, which is a type of resin that is applied onto your tooth and bonds to your teeth to reduce the discoloration. There are dental crowns that can also be used to restore damaged teeth or to whiten the smile. Dental veneers can be used to cover up the front of your teeth and improving the shape of the color. It is also important to remember that whitening procedures, including bonding, veneers, crowns, and bridges, or dentures, cannot be whitened as they are made of porcelain and other materials, but you can, however, whiten your natural enamel.
Okay, so this brings us to the topic of oral cancer. So oral cancer, so here's a so oral cancer is basically when like our oral epithelium tissue becomes thinner and non-resistant with age, and so the oral mucosa lining in our oral cavity becomes permeable to toxic substances and becomes very less disease resistant, and this predisposes patients to many cancerous lesions, which can be very serious and life-threatening. It mainly affects people age 65 and above, and is very much common in people living in underdeveloped countries or regions than developed. But that doesn't go to say that there is like no rates of oral cancer in developed countries. There is still, it's very common phenomenon, and the most common form of cancer in older adults is the squamous cell sarcoma that arises from the lining of the oral mucosa. So diving into risk factors, about 90% of elderly oral cancer patients use tobacco, and a smoker in general is 6 times more likely to develop oral cancer compared to a non-smoker. And alcohol use, again, 75%, such high rates of oral cancer. Elderly patients do drink alcohol frequently. Symptoms. So people with oral cancer develop varying symptoms, but again, oral cancer starts as a tiny red spot or sore in your mouth. And here are some other common signs that you could look for. It includes difficulty in chewing, swallowing, or speaking, difficulty in moving your jaw or your tongue. Um, your biting patterns have changed, and there's sores in your mouth that bleeds very easily and doesn't heal. And there's numbness and pain in your mouth, lumps form in your mouth, and there's also color change that people notice with oral cancer. So prevention. Here are some methods that, once again, people could practice every day to prevent the issue of oral cancer altogether. What first is, don't smoke. I mean, it's a no-brainer at this point. Um, Limit your lips from being exposed to sun, and try to use lip balms that have some kind of a sun protector element or sun blocker element. Try to eat healthy, balanced diet. Look for physiological changes, and get oral cancer screening done if you do, and and get regular dental examinations as per usual. Um, Treatment, again, there are some amount of treatment options if oral cancer becomes unavoidable. The best way is to detect early signs of oral cancer by visiting your dentist regularly and getting screenings done. And after a definite diagnosis has been made and cancer has been staged, treatment may begin. Again, cancer is like oral cancer is not just like the dentist does the job and that's it. Like it is a multidisciplinary approach. It involves efforts of multiple people, including surgeons, oncologists, chemotherapy oncologists, dental practitioners, nutritionists, and restorative specialists. So, um, and the actual curative kind of treatment usually involves chemotherapy combined with radiation or surgical procedures.
So the next disease is called gum disease. So gum disease is a very common type of disease, and it is specifically gingivitis, which occurs as a result of the accumulation of plaque. This causes inflammation of the gums, also known as periodontitis, which can result in tooth loss. So symptoms of gum disease includes bad breath or bad taste that will not go away, red or swollen gums, tender or bleeding gums, painful chewing, loose teeth, sensitive teeth, gums that have pulled away from your teeth, and any change in the way your teeth fit together or align when you bite. So in order to diagnose gum disease, your dentist will ask to see your medical history to check for any HIV or AIDS, medication, smoking, or hormones that may play a role in causing gum disease. The dentist will also ask you if you're experiencing any of the symptoms that were mentioned, and will look for any plaque or tartar buildup to remove it, and to check like any pocket depth in case there is food or bacteria buildup. This weakens the gums, the bones, and the ligaments, leading to tooth loss if not treated. So causes of gum disease can include poor oral health or oral hygiene, any plaque buildup, food left in your teeth, tobacco products, poor fitting bridges, diabetes, anytime you're forgetting to floss, brushing less than twice a day, practicing improper brushing and flossing techniques. If you lack the proper consumption of vitamin C, if you use your toothbrush a bit too hard, if you rinse only with water, if you grind your teeth, genetics can also play a role, and so can age and hormonal changes in women and any medications. So ways of preventing gum disease is by brushing your teeth frequently to remove all the plaque buildup, um, picking up on brush techniques advised by your dentist. Best way to brush is to brush at a 45-degree angle. Go for cleanups and checkups often every 3 to 4 months. And flossing to remove any foods in between spaces. So treating gum disease can vary depending on the stage. So early or mild gum disease, also known as gingivitis, requires non-surgical treatments such as scaling, which will remove the tartar and bacteria from your teeth and that's below the gum line. Root planning, which will smooth the root surfaces, preventing further buildup of bacteria. Antibiotics, which can be topical or oral antibiotics, which can help control the infection. And if it's left untreated, it can progress into periodontitis. However, if your gum disease proceeds beyond gingivitis, it is called periodontitis. And it also requires surgical treatment instead of non-surgical treatment, which involves flap surgery, which are tiny, which basically the dentist creates tiny incisions that are made in your gums to expose the roots so more scaling can be done. Any soft tissue grafts, which is where your dentist removes tissue from your root of your from the roof of your tongue, from the roof of your mouth, and attaching it to the affected site to reduce gum recession. Bone grafting, which is basically when transplanted bone is used to repair and rebuild a damaged tooth to prevent tooth loss. Guided tooth regeneration, which allows for the regrowth of bone that has been destroyed, and tissue stimulating proteins, which is the application of a bone and tissue stimulating gel.
Okay, so this is so now I will be talking about dry mouth. So saliva, as you guys know, plays a very important role in maintaining our oral health. It helps us with chewing, lubricating the food, taste sensation, and speech. It helps with preventing dental caries and other oral infections. Dry mouth is a common oral problem in older adult population with a prevalence of 33%. So with aging, both major and minor salivary glands undergo degenerative changes, hence decreasing the saliva output in the mouth. Symptoms: bad breath. Ew, we know we all hate that. Constant sore throat, difficulty eating, swallowing, and speaking. Dry feeling in the nose, increased thirst, trouble wearing dentures, pain and sores on the lips and mouth. So here are some common underlying causes that contributes to the condition of dry mouth. So it could be side effects of hormone medications, dehydration. Older people are more prone to dehydration than younger people. Diseases such as diabetes, HIV, AIDS can all cause dry mouth. Radiation therapy, basically, it damages the radiation, just damages the salivary glands during the treatment. And chemotherapy, so chemotherapy basically makes the saliva thicker, causing the mouth to feel more dry. And nerve damage, so injury in the neck or head region can affect the production of saliva. Prevention, so again, if these are practiced on a day-to-day basis, you could prevent the issue of dry mouth altogether. So again, gently brushing your teeth twice a day with fluoride toothpaste, flossing regularly, avoiding sticky, sugary foods, or if you do end up consuming them, try to brush immediately after. Rinse your mouth if you're using cough syrup or any kind of syrupy based like medications. Um, Try to use uh, fluoride mouthwash or mouth products that doesn't contain alcohol. You stop the use of tobacco. Um, I also read this really cool thing where if you think you live in an environment that's super dry, and like let's say some people tend to breathe through their mouth and it could contribute to a dry mouth, so you could add room humidifier, which really helps to retain the moisture in the air and could help with that. And also drinking lots of water and avoiding consumption of alcohol or caffeines, as they increase water loss in the body and triggers frequent urination. Treatment. So once the underlying cause is found, and steps need to be taken to minimize it, and here are some effective treatments to prevent dry mouth. Medication. So if dry mouth is thought to be um, if dry mouth is thought to be causing by a particular medication, the doctor can alter the dosage or prescribe another drug, which is likely to cause, which is less likely to cause dry mouth. And saliva stimulating production. So medications may be prescribed to stimulate the production of saliva, which is really cool. And things like pilocarpine or Evozac can do this. And also, there's another thing called symptomatic treatments, which are basically alternative substitutes of saliva that can help improve the condition of dry mouth. And these treatments basically target four main areas, either to increase the flow of saliva, replace lost secretions, control dental caries, and um, take specific measures such as treating because of loss of saliva, if you do develop some kind of infection, these medications can help target that. And examples of symptomatic treatment medications include like xanthan gum or carboxymethylcellulose, and these are very much known to improve production of saliva. And as usual, uh, paying attention to your oral and dental hygiene. If there's one thing that you want to get out of this presentation, a take home message is go visit your dentist at least once a year or twice a year or whatever. But visit your dentist. It's very important that you pay attention to your oral hygiene habits, your how you're maintaining your dental, how well you're taking care of your oral routine and things like that. So very important that you do that and brush your teeth and floss regularly. Important.
Okay, so the last disease is receding gums. So receding gums are most common in older adults. So receding gums occur when gum tissue detaches from the tooth, exposing the base of the tooth, while removing protection. This allows for bacteria to easily increase in growth, causing inflammation and decay. So factors that cause receding gums include brushing too hard, which causes the gums to move, gum disease, which causes the gums to weaken, increasing their chances of moving, and also can be caused by any like teeth grinding or misaligned bites. Ways to prevent gum recession involves taking care of your teeth, brushing and flossing to remove the plaque, but not brushing too hard. So using a very soft bristled toothbrush, visiting your dentist regularly, eating a healthy diet, avoid smoking, observing your oral health and any changes that there might be. If caused by any misaligned bites or grinding your teeth, it is recommended to consult your dentist about that. So treatments for mild gum recession include tooth scaling and tooth planing for deep cleansing of the area. This removes plaque and tartar on your teeth, smoothing the exposed root to reduce interactions, and antibiotics to remove bacteria. For treatments for severe recession specifically, with large amounts of bone loss require gum surgery in order to compensate for the destruction left behind from the gum recession.
So with that, if do you guys have any questions about what we did so far, anything that we discussed?
I think there's a question that Ishwa said in the chat. If you want to check that out, maybe.
So it's about using non-alcohol based mouthwashes. Actually, we don't know. I don't know why, but I feel like maybe wait, was this related to what I was talking about for dentures, the alcohol mouthwash? Because I can't remember. For what, because I do remember like Googling this and finding out that when you do use like for alcohol based mouthwashes or like
I think there's a link now. So there's some research if you guys want to check that out. We kindly have a link in the chat. Thank you for that.
Oh yeah, okay. I was just gonna say I did this for I saw that for like there's certain kind of toothpaste, especially like for people with dentures and stuff, that it's not really good. It creates kind of like, especially with elderly, you don't know, right? Like
Yeah.
and like that kind of creates a lot of it affects the texture of the dentures. That's what I heard.
Yes, yeah. My uncle, he uses dentures, and my cousin said that she used a different type of like, I think it's either the glue or the like cleansing kind of thing.
Mm-hmm.
And he immediately knew that it was a different brand than his normal one. So yeah, different brands do have different quality. So yeah, that's a great point.
Yes, I think it's something that's worth researching. Like,
Sure.
and if that's it, we are gonna quiz you
Any more
guys.
questions, guys?